Hello and welcome to another episode of Med Madness, your go-to resource for mastering medical knowledge and acing the USMLE. Today we delve into a crucial yet often challenging aspect of medical practice, the ethics of physician-patient communication, specifically when considering the termination of the patient-physician relationship. Understanding this topic is vital for medical students and practitioners alike, as it directly impacts the quality of patient care and the integrity of the medical profession. In this episode, we'll cover the reasons behind dismissing a patient, the ethical guidelines to follow, and provide a real-life case study to illustrate these concepts. Next, let's discuss the reasons for dismissal. Physicians may need to terminate the relationship with a patient for several reasons. 1. Compromised therapeutic relationship. This includes situations where the patient falsifies information or fails to adhere to treatment recommendations. 2. Interference with operations. Examples include habitual tardiness for appointments which disrupts the schedule and affects the care of other patients. 3. Causing hardship. Hostile or demeaning behavior towards the physician or office staff can create a toxic environment and hinder the delivery of effective care. Now let's move on to ethical guidelines for termination. When dismissing a patient, it's essential to follow these ethical guidelines to avoid patient abandonment. First, notification. The patient should be notified in writing about the termination. Second, continuation of care. Offer to provide care for a reasonable, finite period, such as 60 days, to allow the patient time to find another provider. Third, medical records. Provide instructions for the patient to obtain a copy of their medical record or to have it sent to their new provider. Finally, avoid crisis situations. Do not terminate care during a medical crisis, such as acute illness, post-operative recovery, or complicated pregnancy. Next, let's consider some alternatives. In some cases, a corrective action plan, like a payment plan for accrued debt, can be considered for otherwise conscientious patients. However, this is not suitable for patients whose deceptive behavior has already compromised the therapeutic relationship. If the patient's behavior compromises future care, initiate dismissal promptly rather than waiting for the patient to leave. Provide general information on finding a new physician, such as a medical society directory or hospital referral line. Avoid directing the patient to a specific provider to prevent mistrust. Immediate termination should be considered only in cases of violent or threatening behavior, severely inappropriate behavior such as sexual misconduct or criminal activity such as theft. Now let's look at a real-life case study. Dr. Smith, a primary care physician, had a patient, Mr. Johnson, who repeatedly provided false information about his medication adherence. Despite multiple discussions and attempts to create a corrective action plan, Mr. Johnson's behavior did not change and he became increasingly hostile towards the staff. Dr. Smith decided to terminate the patient-physician relationship. Following the ethical guidelines, he notified Mr. Johnson in writing, offered to provide care for the next 60 days, and provided instructions on how to obtain his medical records. This approach ensured that Mr. Johnson had enough time to find a new provider without feeling abandoned. To summarize, terminating the patient-physician relationship is a delicate process that must be handled ethically to avoid patient abandonment. Always notify the patient in writing, offer a finite period of continued care, and assist with medical records transfer. For medical students and practitioners, understanding these guidelines is crucial for maintaining professional integrity and ensuring high-quality patient care. Thank you for listening to this episode of Med Madness. Remember to engage with the pre- and post-podcast quizzes and Anki flashcards available for this episode to reinforce your learning. Until next time, keep pushing forward on your journey to medical excellence.